this month's Wellspring webinar. We're going to be speaking about heart health. And so I'm so excited to bring this to you today. So let's go ahead and without any further ado, get started on our presentation of heart health. So first and foremost, we always have to start with our disclaimer, of course, and this presentation is intended for information and educational purposes only. And while I am a licensed physician, I'm not acting in the capacity of a physician for this presentation. So the content is provided for your education. It's not to be construed as medical advice, diagnosis, or treatment. And please always seek the advice of your physician. Never disregard professional medical advice. And no patient-doctor relationship is being established through this presentation. And any and all decisions related to medical care should be made in consultation with a licensed medical professional. So a little bit about Wellspring Healthcare. We believe in the power of compassion, effective communication, and empowering education to transform lives, which is the reason why we do these webinars, because we want to be your source for relevant health information to be explained to you in a way in which you can understand it so that you can appropriately apply it to your lifestyle. So, of course, we want to keep in touch with you. Please don't hesitate to reach out to our medical assistant, William. His telephone number is 816-708-1661. And if you happen to be an administrator of a nursing facility or a nursing home or an assisted living, please, we'd like to partner with you. Please don't hesitate to reach out to our Chief Operating Officer, Brandy, at telephone number 816-708-1658. And please look to our website. We post recordings of all of these webinars on our website as well as YouTube. So please check that out. And we also create blog content if you're more of a reader rather than a watcher. So take a look at those. So let's get started on heart health for February, because of course, February is Heart Health Month, and it's very important to get started on the start of the year with a great, healthy environment. So I really liked this. This was an infographic that I pulled from the National Institute of Health, Heart, Lung, and Blood Institute. And it says, make yourself a priority. Putting our hearts at the top of our self-care list reduces our risk of heart disease and can help inspire others to do the same. Taking that first step to really empower yourself and to be the person that takes charge of your health is extremely important. And I hope that this webinar and your interest in it will be the first step in your journey. So, risks of not taking care of your heart health. Let's start there, right? Because we always talk about what's really beneficial about your heart health, but let's talk about some of the risks, right? So I'm showing here an issue with coronary disease, right? So this is an area of plaque formation that's occurring inside of the artery, and it's narrowing the wall. And what can happen here is that a clot can form, and that can prevent blood flow going down to the rest of the heart, and it can cause a heart attack. And so these are the types of things that we want to try and avoid. We also want to make sure that our heart is healthy and that we don't have to push against a high pressure, which is hypertension. And we want to try and do everything that we can in order to prevent atrial fibrillation as well. So while I was preparing for this talk, I reviewed the 2019 American College of Cardiology and the American Heart Association guideline on primary prevention of cardiovascular disease. And I said, what wouldn't be a better way than to go through this position paper put together by the absolute experts in heart health care, the American College of Cardiology and the American Heart Association. And so they had 10 major takeaways in this article that I wanted to help address with you today. So the first of that is the most important way to prevent atherosclerotic vascular disease, heart failure, and atrial fibrillation is to promote a healthy lifestyle. So we talked in our last webinar, so feel free to check that out. It's on our recorded website. And if you're watching this recorded, we'll have a link for that up in the upper right-hand corner for you. But living a healthy lifestyle is going to be paramount. And we're going to talk a little bit about that, and we'll talk some different strategies that you can use as well. But a second takeaway is utilizing, of course, a team-based approach for your healthcare. So you need to have a multitude of different physicians in order to help care for you. And no physician is more important, in my personal opinion, than your primary care provider. They're going to be the center, that cog in the wheel that's going to be able to help to to get you into the right doctors to help you take care of your health. So for instance, if you have diabetes, maybe you need an endocrinologist. If you have diabetes, there's chances are high that you might already have some aspect of underlying cardiac disease. And so you might need a cardiologist. But maybe you're a former smoker and you have some underlying lung disease. And so you need to have a collaborative approach with all of these different specialists. And the person that helps to facilitate that for you is your primary care provider. All right, so I'm really excited about this. We're going to try something new here. I want to show you a calculator. So this is something that your primary care provider can do for you to help to determine what your risk of cardiovascular disease is. So if you're an adult aged 40 to 75 years of age, and you're coming in to see your primary care doctor, and you're wanting to talk to them about heart health, and you're wanting to talk to them about what's my risk of cardiovascular disease, they have some tests and some questions that they can ask for you. So what we're going to do is I'm going to flip over here to showing you the calculator, and we're going to do our best to kind of go through this together. So here we are showing you that screen. There it goes. All right, so we're going to walk through this together. And so I'm going to do this for me. So I am currently 43 years of age. I am a male. I am white. And my last systolic blood pressure was about 126, and my diastolic pressure was about 83. Now, my total cholesterol was right around 185. My HDL cholesterol, which is something that I'm trying to work on personally, is a little bit on the low side, and it was 27. My LDL cholesterol was 126. I do not have a history of diabetes. I've never smoked. I'm not on any antihypertensive treatment. I'm not on any cholesterol lowering medication, and I'm not taking aspirin. And you can see that this pulled up this risk here of a 3.1% risk of 10-year cardiovascular disease. So I have a pretty low risk, which is great, of cardiovascular disease. But we could go through this calculator again, and if we refresh this and change a few statistics here. So let's change a few statistics and see what we come up with. So if we instead, let's change this and say that I'm 65 years of age. I am a male. Still white, but let's say I have high blood pressure. Okay, so my blood pressure is ranging probably right around 165. My diastolic pressure is 89. My total cholesterol is going to be a little bit higher. Let's say it's 220. My HDL cholesterol is let's say it's similar to where mine was, in the 30 range, but my LDL cholesterol is a little bit higher at 167. And I do have a history of diabetes. Let's say we're a current smoker and we are on hypertensive treatment and we're on cholesterol lowering medication, but we're not on aspirin therapy. And so when we look at that, now all of a sudden our cardiovascular 10-year risk is super high. It jumps up to 61.9%. So I use this as an example because I want to show people that there's ways to be able to do some prediction of what our risk is. And I think it's very important to look at those types of things because it helps us to determine where we need to progress. What do we need to do in order to make the best possible changes to our healthcare? So that's just one of the third takeaways that we can glean from this American College of Cardiology paper talking about your risk factors. So this can help your doctor to help focus on getting your blood pressure under a better range, improving your blood pressure control, etc. All right, let's move on to takeaway number 4. So this was really important. All adults should consume a healthy diet that emphasizes the intake of vegetables, fruits, nuts, whole grains, lean vegetables or animal proteins, and fish, and minimizes the intake of trans fats, red meat and processed red meats, refined carbohydrates, and sweetened beverages. So you know, a lot of the time I have this conversation with patients and they struggle because they're like, Dr. Haas, I don't know how to change my diet. And sometimes it's making one simple change. So one of the things that I do is this sweetened beverages stands out to me. And it's something that is so prevalent in just the culture, our pervasive culture, and changing that simple thing of removing, whether it be soda, whether it be juice, whether it be sweet tea, whatever it is that you do. If you can't remove it completely because that's too big of a change for you up front, reduce it by one, right? And then do that for a week, and then reduce it by two, and then reduce it by three. And next thing you know, you're not drinking any at all, or give yourself one a week. Really try and make sure that you're taking diligent strides. And I think it's very important to determine that if you don't have the best diet right now, you know, that's okay, right? You're taking this step to watch this video in order to be able to learn about this. But now you're going to want to take those next steps. So what are those next steps? Well, to go from not having a healthy diet to having a super healthy diet is a big change. And that might be really hard for you to just jump right into. And so doing something small and incremental would be the first best step. So never discount that. A lot of the times I see patients are like, well, if I can't do everything, then it's not worth doing anything. And it's certainly always worth doing something. All right. So this is another one that we have to talk about a little bit. Takeaway number 5, adults should engage in at least 150 minutes per week of accumulated moderate intensity physical activity. Wow, 150 minutes. That's 5 days a week of 30 minutes of exercise. Now, if you're a non-exerciser, 30 minutes of exercise is a lot of exercise. Now, again, just like we talked about in our last slide on number 4, if your diet isn't great, right? All of a sudden, jumping into a healthy diet is hard. Just like jumping into 30 minutes of exercise 5 times a week, it's going to be really, really hard. But again, we want to start small, and we want to start in a graduated form. So the first thing that I like to recommend to patients is going on a walk, right? If we can set aside 5 to 10 minutes, and we do that every single day for a week, you're going to start to build a habit, and you're going to start to build a pattern. And as the weather gets good in your environment, then that's wonderful, and you can do that outside. But even if you have bad weather, that's not an excuse to not do something. And you can do something, because you can end up walking up and down your hallway for 5 minutes. So there's easy things that you can do to make that concerted effort to start this, because we want to start you to work up. So for your first week, you're going to end up doing 5 minutes, 7 days a week. And then in week 2, maybe you go that to 7 minutes, 7 days a week, right? And then in week 3, you're going to increase that to 10 minutes, 7 days a week. Now you're all the way at 70 minutes. You're more than halfway there. So you're getting upwards in that regards to the amount of exercise that you're doing. And certainly I think that walking is a wonderful first step, but I'd love for people to be able to start incorporating some aspect of strength training as well too. And a lot of people, again, will question that and say, Dr. Haas, well, I don't have access to a gym, or I don't have money for a gym membership, or I can't go out and buy weights. And you're right, you don't have to buy weights, but there's things that you can use around your home that can supplant weights, for instance. So cans out of our pantry, those are great little weights, because they can be a 1 to 2 pound weight. And that's a great little thing just to have added benefit. We can do a lot of things with our body weight that we don't have to use weights for. We can do some squats and things of that nature. Now, again, it's really important to go back to what we talked about before in number 2, and using that team, right? Because we want to make sure that before we start doing an exercise program, that we've talked about this with our doctor, and they've cleared us to be able to start doing these types of activities. They've done an EKG on us, and they've gone through this cardiovascular risk score with us, and they've told us precautions to look for that are important to us. All right. So takeaway number 5, very important to use that in a graded approach. Don't just jump into 150 minutes, and don't let that 150 minutes scare you away from something. All right. So takeaway number 6, a lot of the times heart disease comes hand in hand with diabetes. And so diabetes gets its own separate section here in regards to this journal article that we're talking about. So in adults with type 2 diabetes, lifestyle changes need to be paramount, right? Because if we can't control the diabetes, it's going to worsen our cardiovascular disease. So one of the number one risk factors associated with the development of cardiovascular disease is diabetes. So controlling that diabetes, getting that A1C that you should know, right? So when I say hemoglobin A1C, if you're a diabetic, you should be able to tell me, Dr. Haas, I know my hemoglobin A1C is 6.9 or 7.4, or maybe you're still working on it and it's 8.6, or maybe you just got diagnosed and your hemoglobin A1C is 12. These are things that we're going to want to work on and we're going to want to monitor. And having that primary care doctor or having that endocrinologist to guide you through that process is going to be paramount. All right, takeaway number 7, smoking. Another major risk factor in the development of any sort of vascular disease, right? It could be cerebrovascular disease. It could be cardiovascular disease. It could be renal disease, is smoking. Adults should be assessed every single healthcare visit for their smoking. And if your doctor doesn't bring it up, you need to bring it up and say, Doctor, I'm interested in quitting smoking. And there's lots of strategies that people can use for quitting smoking. Certainly there are some medications, but one of the things that I find more beneficial than anything else is a form of cognitive behavioral therapy. We use it a lot in, or people might be more familiar with it in AA, right? Alcoholics Anonymous, where they use a group-based setting and personal accountability and coaching and peer group coaching to be able to help one another. So when an alcoholic goes into AA, often they will get a sponsor. And that sponsor is someone that has been through this process, is a recovering alcoholic, and is willing to take on a person to say, call me if you need help. And I think that's so important. And it's an overlooked tool for patients that are trying to quit smoking. And I find that using a person that is a close personal friend, not a family member, but someone whose opinion that you value greatly. So this could be a friend from 20 years or 40 years, or maybe it could be a new friend. Someone that's quit smoking before would be a great person to use because they know what you've been through and they know the struggles that you've been through. But a lot of the time when we have those cravings, if we reach out to this person that we've identified, they can sometimes help you to avoid that craving that you're looking for. So again, smoking cessation is huge. All right, we're going through these pretty quickly. So takeaway number 8. Now, this was something that I think is important, especially for the nurses and the doctors and the health institutions that are watching this webinar. Aspirin should be used infrequently in the routine primary prevention of cardiovascular disease because of a lack of benefit. So unless you have underlying coronary disease, putting you on a preemptive aspirin doesn't necessarily lend any significant mortality benefit. So if you're a 45-year-old or a 46-year-old or a 40-year-old, and you had a cardiovascular risk factor that was like mine when we first did it, and it was about 3.1%, and you're low risk, you're probably not someone who would benefit from being on a daily aspirin. Now, on the other hand, if you're a person like we did after, where I made that up, and you're someone that has significant risk factors, now that's a person that would probably benefit from aspirin. So again, this becomes very nuanced and important. And so if you've just started yourself on aspirin, you really need to go into your primary care doctor and talk to them about that and determine whether or not that's really beneficial for you. All right. Who knew we were going to get to cholesterol? Everyone, right? So statin therapy is going to be first-line treatment for primary prevention of cardiovascular disease with patients with elevated cholesterol levels. So I went ahead and pulled a little graphic here, and I think that this graphic does a great job of kind of showing us the different types of cholesterol, because there's really 2 main types of cholesterol. There's a good cholesterol that you hear about, and that is your HDL cholesterol. And that's cholesterol that helps to mobilize so that your body can use cholesterol. Then we have LDL cholesterol. And this is the quote unquote bad cholesterol that will usually get deposited into your arteries. And so we want to keep our cardiovascular health the most the most that we can keep our cardiovascular health squared away here is by having a lower LDL cholesterol and a higher LDL cholesterol. Now, there's really not many ways to increase your HDL cholesterol other than exercise, and sometimes a moderate amount of alcohol will do that. Although in reality, there's not really an ideal amount of healthy alcohol level. So again, our total cholesterol level, we want to be below 200. We want to see our HDL cholesterol above 40, and we want to see that LDL cholesterol below 130. Triglycerides is another type of fat that we see, and it's highly variable depending upon what types of foods that you eat. So if I was going on a road trip and I stopped by a fast food restaurant, let's say the Golden Arches, for instance, and I had a lot of French fries and a cheeseburger, my triglycerides would go up rapidly after eating that type of meal. So the great news about triglycerides is that we can help to modulate triglycerides by what we eat. Same thing can be said for HDL and LDL cholesterol, but those are not nearly as reactive as our triglyceride levels can be. All right, so now we have gotten to our 10th takeaway in the heart health webinar here. Non-pharmacological interventions are recommended for all adults with elevated blood pressure. For those requiring pharmacological therapy, we want to get a blood pressure below 130/80. So again, when you have some minor problems like high blood pressure, high cholesterol, diabetes, we really want to focus on getting those things down, and we might benefit from starting you on cholesterol lowering medication, and we might need to start you on metformin for your diabetes. But we also want you to take into consideration the healthy lifestyle factors. So we want you to eat healthy. We want you to start exercising like we talked about. We want you to watch minimizing those bad dietary factors that you're doing and cutting those small things out. And certainly we want you to stop smoking if you are a smoker. So again, this kind of encompasses our 10 different takeaways from this article on heart health and watching what we eat to maximize our benefit here. So that's going to conclude our webinar today. I want you to go ahead and join us next month for our webinar on ethical and legal considerations in end-of-life care. And you can register for that at wellspringhealthcare.org. If you just scroll down to about the middle of the first page, there is a scrolling window that will show you all of the upcoming webinars that we have. And those continue to be updated on a daily or a weekly and monthly basis. So please check back frequently for that. And you can also sign up for our blog as well too. So if you're interested in reading some of this material or you want to pass this along to somebody else, please don't hesitate to share this webinar or also to subscribe to our blog posts as well. So again, please, let's keep in touch. Please feel free to reach out to our medical assistant, William. If you're a facility that's interested in partnering us, please reach out to Brandy at telephone number 816-708-1658, or again, reach out to us on our website. And we look forward to seeing you at our next webinar. Before I leave, let's check and make sure if there's any questions in our chat. It doesn't look like we have any questions today. So thank you everyone for attending. You have a wonderful afternoon and you take care.